BLENREP. Mechanism of action. For the treatment of appropriate patients with relapsed or refractory multiple myeloma. BLENREP is indicated for the treatment of adults with relapsed or refractory multiple myeloma who have received at least 4 prior therapies, including an anti-CD38 monoclonal antibody, a proteasome inhibitor, and an immunomodulatory agent. This indication is approved under accelerated approval based on response rate. Continued approval for this indication may be contingent upon verification and description of clinical benefit in confirmatory trials. Warning: ocular toxicity. BLENREP caused changes in the corneal epithelium, resulting in changes in vision, including severe vision loss and corneal ulcer, and symptoms such as blurred vision and dry eyes. Conduct ophthalmic exams at baseline prior to each dose and promptly for worsening symptoms. Withhold BLENREP until improvement and resume or permanently discontinue based on severity. Because of the risk of ocular toxicity, BLENREP is available only through a restricted program under a Risk Evaluation and Mitigation Strategy, REMS, called the BLENREP REMS. Please see important safety information contained in this video and full prescribing information, including boxed warning. B-cell maturation antigen, BCMA, is a cell surface protein present on myeloma cells, late-stage B cells, and plasma cells, but has little or no expression on naive and memory B cells. BCMA expression is virtually absent elsewhere. In all patients, BCMA expression is elevated on myeloma cells versus healthy cells. BCMA has also been shown to drive cell proliferation and survival. BLENREP is the first and only BCMA-targeting antibody-drug conjugate and is composed of a humanized anti-BCMA monoclonal antibody, conjugated to the cytotoxic agent mafodotin by a protease-resistant linker. BLENREP exerts anti-tumor activity via a multimodal mechanism of action, delivering a cytotoxic payload and mediating tumor cell lysis through ADCC and ADCP. BLENREP may also have an effect on normal cells. The rest of this video will focus on the potential effect of BLENREP on malignant cells. Upon binding to BCMA, BLENREP is internalized. Once inside the tumor cell, the free cytotoxic drug cis-MCMMAF, also known as mafodotin, is released. Mafodotin is a potent microtubule network disruptor that binds to tubulin, which disrupts cellular function, leading to cell cycle arrest and apoptosis. BLENREP also has an afucosylated antibody that enhances the potency and efficacy of effector cell-mediated antibody-dependent cellular cytotoxicity, ADCC, and antibody-dependent cellular phagocytosis, ADCP. BLENREP, the first and only FDA-approved antibody-drug conjugate to leverage the specificity of BCMA on malignant plasma cells while exerting anti-tumor activity via a multimodal mechanism of action. Important safety information. Warnings and precautions. Ocular toxicity. Ocular adverse reactions occurred in 77% of the 218 patients in the pooled safety population. Ocular adverse reactions included keratopathy, 76%, changes in visual acuity, 55%, blurred vision, 27%, and dry eye, 19%. Among patients with keratopathy, N equals 165, 49% had ocular symptoms, 65% had clinically relevant visual acuity changes, decline of 2 or more lines on Snellen visual acuity and NEI, and 34% had both ocular symptoms and visual acuity changes. Keratopathy. Keratopathy was reported as grade 1 in 7% of patients, grade 2 in 22%, grade 3 in 45%, and grade 4 in 0.5% per the KVA scale. Cases of corneal ulcer, ulcerative and infective keratitis have been reported. Most keratopathy events developed within the first 2 treatment cycles, cumulative incidence of 65% by cycle 2. Of the patients with grade 2 to 4 keratopathy, N equals 149, 39% recovered to grade 1 or lower after median follow-up of 6.2 months. Of the 61% who had ongoing keratopathy, 28% were still on treatment, 9% were in follow-up, and in 24%, the follow-up ended due to death, study withdrawal, or loss to follow-up. For patients in whom events resolved, the median time to resolution was 2 months, range 11 days to 8.3 months. Visual acuity changes. A clinically significant decrease in visual acuity of worse than 20/40 in the better seeing eye was observed in 19% of the 218 patients and of 2200 or worse in the better seeing eye in 1.4%. Of the patients with decreased visual acuity of worse than 20/40, 88% resolved, and the median time to resolution was 22 days, range 7 days to 4.2 months. Of the patients with decreased visual acuity of 2200 or worse, all resolved, and the median duration was 22 days, range 15 to 22 days. Monitoring and patient instruction. Conduct ophthalmic examinations, visual acuity and slit lamp at baseline, prior to each dose, and promptly for worsening symptoms. Perform baseline examinations within 3 weeks prior to the first dose. Perform each follow-up examination at least 1 week after the previous dose and within 2 weeks prior to the next dose. Withhold BLENREP until improvement and resume at same or reduced dose, or consider permanently discontinuing based on severity. Advise patients to use preservative-free lubricant eye drops at least 4 times a day, starting with the first infusion and continuing until end of treatment. Avoid use of contact lenses unless directed by an ophthalmologist. Changes in visual acuity may be associated with difficulty for driving and reading. Advise patients to use caution when driving or operating machinery. BLENREP is only available through a restricted program under a REMS. Thrombocytopenia. Thrombocytopenia occurred in 69% of 218 patients in the pooled safety population, including grade 2 in 13%, grade 3 in 10%, and grade 4 in 17%. The median time to onset of the first thrombocytopenic event was 26.5 days. Thrombocytopenia resulted in dose reduction, dose interruption, or discontinuation in 9%, 2.8%, and 0.5% of patients, respectively. Grade 3 to 4 bleeding events occurred in 6% of patients, including grade 4 in 1 patient. Fatal adverse reactions included cerebral hemorrhage in 2 patients. Perform complete blood cell counts at baseline and during treatment as clinically indicated. Consider withholding and/or reducing the dose based on severity. Infusion-related reactions. Infusion-related reactions occurred in 18% of 218 patients in the pooled safety population, including grade 3 and 1.8%. Monitor patients for infusion-related reactions. For grade 2 or 3 reactions, interrupt the infusion and provide supportive treatment. Once symptoms resolve, resume at a lower infusion rate. Administer pre-medication for all subsequent infusions. Discontinue BLENREP for life-threatening infusion-related reactions and provide appropriate emergency care. Embryo fetal toxicity. Based on its mechanism of action, BLENREP can cause fetal harm when administered to a pregnant woman. Advise pregnant women of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with BLENREP and for 4 months after the last dose. Advise males with female partners of reproductive potential to use effective contraception during treatment with BLENREP and for 6 months after the last dose. Pregnancy testing is recommended for females of reproductive potential prior to initiating BLENREP. Adverse reactions. The pooled safety population described in Warnings and Precautions reflects exposure to BLENREP at a dosage of 2.5 milligrams per kilogram or 3.4 milligrams per kilogram, 1.4 times the recommended dose, administered intravenously once every 3 weeks in 218 patients in DREAM-2. Of these patients, 194 received a liquid formulation, not the approved dosage form, rather than the lyophilized powder. Patients received BLENREP at the recommended dosage of 2.5 milligrams per kilogram, administered intravenously once every 3 weeks. N equals 95. Permanent discontinuation due to an adverse reaction occurred in 8% of patients who received BLENREP. Keratopathy, 2.1%, was the most frequent adverse reaction resulting in permanent discontinuation. Dosage interruptions due to an adverse reaction occurred in 54% of patients who received BLENREP. Adverse reactions which required a dosage interruption in greater than 3% of patients included keratopathy 47%, blurred vision 5%, dry eye 3.2%, and pneumonia 3.2%. Dose reductions due to an adverse reaction occurred in 29% of patients. Adverse reactions which required a dose reduction in greater than 3% of patients included keratopathy 23% and thrombocytopenia 5%. The most common adverse reactions greater than or equal to 20% were keratopathy 71%, decreased visual acuity 53%, nausea 24%, blurred vision 22%, pyrexia 22%, infusion-related reactions 21%, and fatigue 20%. The most common, grade 3 or 4, greater than or equal to 5%, laboratory abnormalities were lymphocytes decreased 22%, platelets decreased 21%, hemoglobin decreased 18%, neutrophils decreased 9%, creatinine increased 5%, and gamma-glutamyl transferase increased 5%. Serious adverse reactions occurred in 40% of patients who received BLENREP. Serious adverse reactions in greater than 3% of patients included pneumonia 7%, pyrexia 6%, renal impairment 4.2%, sepsis 4.2%, hypercalcemia 4.2%, and infusion-related reactions 3.2%. Fatal adverse reactions occurred in 3.2% of patients, including sepsis 1%, cardiac arrest 1%, and lung infection 1%. Use in specific populations. Lactation. Because of the potential for serious adverse reactions in the breastfed child, advise women not to breastfeed during treatment with BLENREP and for 3 months after the last dose. Females and males of reproductive potential. Based on findings in animal studies, BLENREP may impair fertility in females and males. Geriatric use. Of the 218 patients who received BLENREP in DREAM-2, 43% were aged 65 to less than 75 years, and 17% were aged 75 years and older. Keratopathy occurred in 80% of patients aged less than 65 years, and 73% of patients aged 65 years and older. Among the 95 patients who received BLENREP at the 2.5 milligrams per kilogram dose, keratopathy occurred in 67% of patients aged less than 65 years, and 73% of patients aged 65 years and older. Renal or hepatic impairment. The recommended dosage has not been established in patients with severe renal impairment. eGFR 15 to 29 milliliters per minute per 1.73 meters squared, or end-stage renal disease (ESRD) with eGFR less than 15 milliliters per minute per 1.73 meters squared, not on dialysis or requiring dialysis. The recommended dosage has not been established in patients with moderate or severe hepatic impairment, total bilirubin greater than 1.5 times ULN, and any AST. Please see full prescribing information, including boxed warning.